Thanks very much, Brian, and thanks to everybody for joining us. Especially thank you to Lindsey Garber, who has agreed to present this information on the epidemiology of recent high-path and low-path AI outbreaks in the U.S. This presentation was given by Amy Delgado at the U.S. Animal Health Association meeting in October, and Arlene Buchholz I believe, heard it and suggested that perhaps we present it on this call. And so thanks everyone for joining it. This is not a usual time for us. We usually have our calls earlier, but this was best for Lindsey. So Lindsey, thank you very much for your willingness to present to us today. And maybe you can give us a little introduction of yourself, and then feel free to go ahead and get started.
Sure. So my name is Lindsey Garber, and I'm the poultry epidemiologist for the National Animal Health Monitoring System. And I don't know if all of you are familiar with what that is. What we do is we conduct national studies on animal health and production, and we look at different commodities every year, but we've also been fairly involved in some AI work and did several avian influenza epidemiologic studies. So I'm going to talk about primarily this last outbreak that we had in 2017, and then bring in some information about previous outbreaks and say, well, what can we learn after having, 3 outbreaks in 3 years, and what were some commonalities and what were some differences. So if I could have the next slide, please, Brian. So in March of 2017, a farm was diagnosed with having high-path avian influenza H7N9. It was having a spike in mortality, which is what alerted us to the fact that this was going on. And area surveillance managed to pick up several other farms that were infected with avian influenza. One other farm was also the high-path AI, and then there were 12 farms that were infected with low-path AI. So 6 of these were commercial broiler breeders, and 6 were backyard flocks. And the 2 high-path farms were also broiler breeder farms. Next slide, please. So this slide shows the breakdown of number of birds that either died or were depopulated for both commercial flocks and backyard flocks, and you see that there was a total of 253,000 birds that were lost as a cause of this outbreak. Next slide. So having gone through this now for the 3rd year in a row, some questions were coming up as to how is this happening? How are farms becoming infected? How is it moving from farm to farm? What can we learn about the transmission of this virus that we could apply to future outbreaks? Next slide. So for this outbreak, it was a fairly small outbreak, but at the outset we had no idea whether it would become a massive one like what happened in 2015, or if it was going to be relatively small. We took 2 approaches. One was to look at a case series, and the case series is looking at all of the cases and seeing what commonalities do they have, and trying to tease out, this is more hypothesis generating, what could have been a risk factor to allow this virus to come onto these farms. But in the case series, we don't have controls to compare to. So we don't know if these are unique to case farms or if it was just noise because control farms were doing the same thing. We couldn't do a case control study because, again, this was small and we wouldn't have had enough sample size to really make statistical inferences as to whether the cases were different from controls. And in addition, doing a case control study is very burdensome, and in the face of an outbreak, we're more concerned with trying to find cases and putting out the fire than doing studies. So that's why we took the approach of a case series rather than a case control study in this particular outbreak. The second thing we did was to, in order to really get a look at cases and controls and seeing if they're different, was we did what's called an expert elicitation. And what this is where we asked experts, and in this case it was veterinarians who were employed by the companies of the farms that were involved in the outbreak, and they were able to provide information about a case farm and a control farm in comparison, so we could then see whether there were differences between cases and controls. Next slide. So let's start with what did we find in the case series. So these were broiler breeder farms, so their biosecurity is pretty good, and yet still we had eight farms, 2 high path and 6 low path farms that managed to get the virus into their flocks despite the level of biosecurity that you see on broiler breeder farms. So some of the things that we saw that all of the case farms were doing right, that we've identified as being protective in other avian influenza studies, included things like the birds had no outside access, they maintained a clean, dirty line, employees were required to stay off the farm after they'd been exposed to birds. The employees were not allowed to own poultry. They didn't see waterfowl around. They didn't raise other poultry on the farm. And they used municipal water sources. So these case farms were doing these things, and yet they still became infected. Next slide. So what were they doing that we found in previous studies to be potential risk factors? One thing that we've seen in previous studies is having a company service visit. Although I want to caution about thinking of this as a risk factor because it's possible it could be an effect rather than a cause. It's possible that because they were having problems, they called the company service person to come out, and not that the company service person was transmitting the virus. However, since company service person does come up as a commonality across case farms, it's something that producers may want to think about the biosecurity procedures that these people go through when they visit farms. Other things that came up in the case series that were common across case farms were sharing vehicles with other farms and sharing equipment with other farms. These farms were also commonly had a water body within 350 yards. And another commonality was that these farms used composting as a dead bird disposal method. Next slide. The expert elicitation study, so this is where we asked the company veterinarians to describe, well, we asked them the same questions about case farms and an uninfected farm to see how they differed. So a lot of this was the company vet's impression or there's a little bit of bias there in that there isn't exact measures, but just asking the company that what do they think about the case farms and what do they think about the control farms in these certain areas. But nevertheless, certain things came up that were different across the different farms and across the different veterinarians that were worthy of considering as potential risk factors. One is habitat disruption, and what this is anything where that might attract rodents, such as seed spillage. One thing that came up over and over again was a neighbor depopulating or selling out. I guess this may be causing the rodents from that farm to seek an area that was more amenable to feeding them. Another one was having multiple age groups on the farm. Also enclosure defects. So this is talking about having maybe tears or holes in the barns where rodents or animals or birds could get in. Another risk factor that came up was poultry farming density. So the case farms were located in more poultry dense areas compared to the control farms. Also, wild mammals such as raccoons, possums, and skunks were believed to be more common on the case farms, as well as heavy rodent populations. So if I could have the next slide. So the question is, particularly with low-path avian influenza, where we don't find it until we start doing area surveillance because a high-path event occurred. We're wondering, when did this virus get introduced? How long has it been hanging around in poultry before it became a high-path virus that was easily detectable? So we asked for egg production and mortality data on case farms, and this is showing egg production for 3 of the low-path farms, several barns. We have 2 barns for 2 of the farms and 4 barns for the 3rd farm. And what we saw here is that what's typical of egg production on broiler breeder farms is that when the birds are placed, there's a rapid increase in egg production, which then plateaus and then gradually decreases. But if you look toward the end of this right side of the graph, you see these open circles are dates that the farm did routine ELISA testing for avian influenza and had negative results. And the dark diamonds are when we found a positive PCR on the farm. And in between those 2 places, a negative ELISA test and a positive PCR test, we see a little dip in egg production, which then recuperates. So it's theoretically possible, in fact likely, that this dip in egg production may be related to having low-path avian influenza on the farm, which was unrecognized. It's just a very small dip in production. May have been considered to be some other problem going on, but perhaps this was a clue that avian influenza was present at that time. The other thing, which I don't have the graph here to show, is at the same time as this little dip in egg production, we saw a little increase in mortality as well. So these could be clues that avian influenza was happening prior to the diagnosis. Next slide. Okay, so the next thing I'm going to talk about is some genetic epidemiology, so phylogenetics, and how do we how do we use the genetic information to try to understand what's happening. So if you look at the diagram on the left, you see that there's these long lines. The phylogenetic analysis, called network analysis, looks at not geographic distance, but genetic distance. How different is one virus isolate from another? And if you have long lines, like you see here, it indicates separate point introductions because these are very genetically different isolates. And that's what happened here. This is showing the phylogenetic information from the 2015 outbreak, more in the Minnesota area, actually 5 states. And as you can see on the map where these isolates came from, and that we have these long branches in the phylogenetic analysis. Next page. Compared to during the same outbreak in Iowa on the Laird farm, you see this kind of short, stubby little lines for the phylogenetic analysis. This indicates more genetic similarity, and this would be consistent with a point introduction with lateral spread, where it's the same, more similar virus across different farms. Next slide. So what happened in this outbreak in the H7N9, the phylogenetic analysis suggests that there was a single point, multiple single point introductions, but on one farm, it mutated to the high path form, and that high path virus was spread laterally to the other high path farm. So that's how this phylogenetic information can kind of help us look at the timing and frequency and how it spread. Go to the next slide. So the next question is what can we learn from the 3 outbreaks? How are they similar? How are they different? What can we bring forward to the future to be able to rapidly identify and contain an outbreak? One thing we can look at are the geographic patterns. So this is the outbreak in 2017. And we see that it's not very clustered. There's dots kind of all over the place. And this is consistent with multiple introductions of the virus, which was also consistent with the phylogenetic information that we saw earlier. Next slide. In contrast, here's the upper Midwest and Iowa, the Iowa outbreak in 2015. And we see geographically that there's quite a bit of clustering. And this is also consistent with the phylogenetic information that showed that the virus was very similar. Next slide. Okay, here's what happened in Indiana in 2016. So in this outbreak, the virus seemed to follow a single road. This was in turkeys. So it's not quite as clear-cut as the other 2 as far as whether it was multiple introductions or a single introduction with lateral spread, but the general thinking by people who know a lot more about this kind of thing than me seems to be that it was lateral spread. Next slide. Okay. Next, I'm going to talk about some wild animal testing, particularly wild birds. Next slide. So wild birds, particularly wild waterfowl, are routinely tested by wildlife services, and the timing of the testing is normally from August through late winter. And we see on the bottom graph the timeline for influenza A viruses. We have a peak in early autumn and a peak in mid-winter, and that happened, routinely. So we see that happening 2 years in a row. Although some of this may be a little bit biased because of the lack of testing during the spring. If we look at the H7 viruses, which is the top graph, we see that there's a peak primarily in the winter, and this is what we saw with H7 this year. Next slide. The other thing that we looked at over the 3 outbreaks was risk factor studies. So there were several risk factor studies that were done. In the 2015 outbreak, there was a case control study for turkeys as well as a case control study for table egg layers. In 2016, on the turkey farms, there was a small case control study as well. And then, as I talked about earlier, in 2017, we had the case series and expert elicitation. So the question is, are there risk factors that come up over and over again that we can say, oh, we really need to work on this aspect of biosecurity because we can count on this being a risk factor come next year? So some of the things that came up over and over again was proximity of poultry, close proximity to other farms, which is something that they can't really do anything about other than to say, be aware of, oh, I'm in a really poultry dense area, I'm at particularly high risk. Another risk factor that appeared over and over was using rendering for dead bird disposal, as well as having the dead bird disposal area located near the barn. So particularly combining those 2 risk factors would not be a good thing. So if they're going to use rendering for disposal, they may want to consider having their dead bird disposal area being out at the perimeter of the farm and not having the renderer trucks enter the farm. Another risk factor that showed up multiple times is having wild mammals around coming on the farm. So they could be spreading it either biologically or as a mechanical vector from one farm to another. And also visitors, and in particular the service person, as I mentioned earlier, which once again, we can't say with certainty that that's a cause or effect, but because it comes up over and over again, you might want to look at how the service person's biosecurity procedures are performed. Next slide. So in summary, we see that there are some differences across outbreaks. Different strains behave differently. They have different levels of infectivity, different levels of pathogenicity, but there are also some similarities, some risk factors that come up over and over again. We can look at the phylogenetics to get a handle on the behavior of that particular outbreak, and hopefully by looking at these series of outbreaks, be more prepared for outbreaks in the future. Next slide. So with that, I'll try to answer any questions.
Lindsey, thank you so much. Fascinating presentation. What catches my attention is references to composting being used for mortalities. And just to clarify, that was routine mortality composting, correct?
That's correct.
Okay. And from the final slides, it appears that those compost piles were near the barns. So is that also a correct assumption?
Well, I don't know that we can go directly from A to Z there, but what they do is they pull out their dead birds and they may put them in a pile near the barns, and then at the end of the day or at the end of the week or whatever, take those to wherever they're composting them. It wasn't necessarily the same farms using compost for dead bird disposal as having dead bird disposal at near the barns. And also, I want to point out that it was on the case series that we said that it was a commonality that composting was being used, but because we don't have control farms, it could be that these companies use composting for their dead bird disposal, and the control farms were also doing that, and it wasn't actually a risk factor.
Great,
Does that make
great.
sense?
Yes. So people on the phone, you can either ask questions through the chat function on the Blue Jeans application, or unmute yourself and feel free to ask questions verbally as well.
To unmute your phone, the command is *4.
And so while we wait for those questions, did you personally visit any of these farms? So do you know if the composting operations were like constructed bins or whether they were open windrows?
I only visited one farm, and that was in Minnesota, where they were doing composting for disposal. And for their routine composting for disposal, I really couldn't tell you how they were doing it. I'm sorry. I don't even know who I could ask to. Oh, you know what? I know some people who were down there, and they could probably answer that for you. So I'll find out for you.
Okay, that would be great. Kind of the reason I ask is that during routine operations, composting, rendering, there's a number of viable options to handle the routine mortalities. And our sister agency, NRCS, provides assistance to farmers to help them set up routine composting bins and, so forth. In a disease outbreak, we have a different approach where APHIS is the lead, and the composting we do is in windrows as opposed to bins. And so I'm just wondering if the folks who are doing the routine mortality composting, if they're getting sloppy with their processes, if they do or don't use the NRCS protocols. So that's just something I'm wondering about. I don't, so it's more of a rhetorical question than one that I'm looking for an answer, but, definitely maybe something that we want to think about further, and maybe even get NRCS to talk to us about what they've seen in terms of routine composting.
Right, and actually, I think in our questionnaire on this last outbreak, we had some questions about whether they kept the bins covered, and some questions about the handling of the bins. But because we only had like 5 operations and everything was different, it was really hard to do anything with that information. But I could ask the 2 people who actually went down there what they saw and what their impressions were of the routine compost. Your question is about the routine composting, not the
Yeah, my question is about the routine composting and whether that is contributing to outbreaks and whether that's an area for improvement or, so this is a composting technical group on this call. And so we're particularly interested in, the aspects of composting and how things could be improved, better coordinated, and so forth.
I will say that composting did not come out as a risk factor on the expert elicitation on the same study. So, it is possible that both case farms and control farms used composting, and that's just how they dispose of dead birds, as opposed to case farms use composting and control farms use incineration or something else, that where it would be an actual risk factor.
Hello, Lori. This is Richard. I was present at the farms in Iowa and in Indiana. I can't speak for the ones in the southeast because I didn't visit any of those, but several of the farms used composting, and they were done in, I suppose you could call it a bin. Some had basically a three-sided barn with a roof over it. Others had just a roof and maybe a little concrete wall around the bottom, and they varied in size from anywhere from 20 by 20 to 2 or 3 times that. And they would typically throw their birds in there and just cover them up. And some of them did it very well, and you didn't see much evidence of exposed birds or predator activity, but some of them did not do so well. And these birds would just typically sit in there for a long time before they would finally, I guess they waited till they filled it up before they removed any of them. So they do use a sort of a bin type system, but it's really more designed for volume. It's just typically an open storage barn area that they would use. And we did make them reconstruct some of those compost piles in order to achieve the temperatures we needed to eliminate the virus in the barns that were infected.
Thank you for that, Richard. Yes.
Lori, this is Bob.
Hey, Bob.
Yeah, Gary and I were just chatting that what we observed in Minnesota, most of the farms had bins, but what I think the concern that we had was that they were just taking the birds and leaving them outside the door and for extended periods of time. Now, they probably have corrected that now, but I think that it wasn't so much the type of composting. The composters were, I think, far enough away from the barns, but they just weren't getting the birds there in a timely fashion to the composter.
Right, and that was what we were finding over and over again as a risk factor, was having the dead birds near the barns. And in fact, in Minnesota, composting did not come up as a risk factor, rendering did. So it would be more like that the dead birds are sitting there by the barns, and the renderer comes in and up close to the barn after having just come from another farm with sick birds and picking them up.
Yeah, and another issue we had in Indiana, at least, was at one farm, they would move the birds to another farm in order to compost their normal mortalities. So there was transport of the birds going on as well, at least in one instance that I'm aware of.
Hey, this is fascinating. It really points up the issue of storage prior to disposal. So post-mortem, prior to disposal, that storage time and method is really important. And I think it's an area that we haven't thought about much, and that it seems to be an area of significant risk where we could make lots of improvements. So that's really important point, I think, to come out of this information. So really, really interesting. Any other questions, comments? I'm not seeing any in the chat, and I'm not hearing any. So if there are no other questions for Lindsey, I want to thank you, Lindsey, so much for coming on to talk to us about this. fascinating talk, and thanks to everyone with questions and participation in the call. And if we have new information regarding our questions that comes out after words, I will send it out to the group as well. So thank you all very much for participating, and we will talk to you again next month.
Well,
That concludes.